Now that we've talked about how a pinched nerve in the neck can present, it's important to understand this so we can start learning about how your body is actually behaving. As we discussed, symptoms can sometimes be peripheralized, meaning they show up further from the source of the problem in the neck. This brings us to our main goal with treatment: centralization. Centralization means guiding your symptoms back towards the source, in this case, the neck. Essentially, we want the discomfort in the back, arm, shoulder, or hand to move upward, closer to where it's originating from. In general, the farther symptoms are from the source, the more attention and consistency your treatment will require. I tell every irritated nerve root patient I see, it must come up to come out. As you start your exercises, you may notice more concentrated neck discomfort. This is completely normal and is actually a good sign. It shows that your spine is responding to the routine. On the other hand, if symptoms are lingering between the shoulder blades, in the shoulder, down the arm, or into the hand, it usually means the condition is being untreated or irritated. You can use this information to start understanding how your body is behaving. If your symptoms are moving upwards towards your neck, you are doing things your spine likes. If symptoms move back down into the shoulder blades or arm, it usually means you did something your spine did not like. In general, the more severe the symptoms are, the longer they may take to centralize. It's also important to know that symptoms tend to centralize faster than they completely disappear. This means symptoms may move back to the neck relatively quickly, but then linger there for longer. This is normal. Learning to read these signals can help you better gauge your activities and make smarter choices day to day. Another important point to understand is that symptoms from an irritated nerve in the neck improve gradually. Most people notice meaningful progress within about 3 months, with continued gains in strength and resilience over the rest of the year. Nerves heal slowly, roughly 1 millimeter per day, so patience and consistency are key. This isn't an overnight fix, and that's okay. I also like to compare rehab to the stock market with my patients. In general, we want to see an upward trend, but some days your symptoms may flare unexpectedly. This is completely normal. Progress is rarely linear, and occasional setbacks are just part of the rehab process. With all of this in mind, the next step is learning what not to do so you don't inadvertently slow your progress or trigger setbacks.